Hello friends, this video on excretory products and their elimination part 14 is brought to you by examfear.com. No more fear from exam. So with this, I think we have discussed about the human excretory system. At least we have discussed about the most important organ of the excretory system, that is kidney. Now, another important thing to note here is that other than kidney, there are few other organs in our body which also can act as excretory organs. In fact, which also act as excretory organs, but just that they excrete only small amount of wastes. So let us look at some of the other excretory organs and what waste materials do descend out of our body. So some of the other excretory organs other than kidneys are the lungs, liver, skin. So these are some of the important other excretory organs. Kidneys we have already discussed for so long. Lungs, what about lungs? So what do the lungs do? Now, as we all know, lungs are the most important organ for the process of respiration. But even during respiration, what do? They take in oxygen and they give out carbon dioxide. So in a way, they help the body to get rid of carbon dioxide. And carbon dioxide is also a waste in our body because carbon dioxide is produced as a byproduct by each and every cell of the body by the process of cellular respiration. So this carbon dioxide is excreted out of the body by the lungs, and almost 18 liters of carbon dioxide are removed out of the body in one day. So it is not only carbon dioxide, it also helps to excrete some amount of water when we breathe out. So that is how lungs act as an excretory organ. If you talk about liver, we know liver as a part of the digestive system because it secretes the bile. And what does the bile contain? The bile contains so many stuffs or so many chemicals like the cholesterol, bilirubin, biliverdin, so many vitamins and drugs. So all these components are present in the bile. And what happens to all these substances? Not all of them are useful for our body. Now whatever is required is being utilized for the process of digestion. But once that utilization is done, all these substances are ultimately excreted out as digestive wastes. Excreted out in the sense all of them are digested through the anus. So that is how it is thrown out of the body. So liver also acts as an excretory organ. And then you talk about skin. Skin is a very important excretory organ, you can say, because in skin you have some important glands. For example, the sweat glands. All of us sweat a lot sometimes when you do a lot of exercise or when you go out in the hot sun or during a very hot weather. Now what does this sweat contain? It looks like water, but it is not only water on the surface of our body. This watery fluid contains a lot of waste materials like sodium chloride, urea, lactic acid, and all these are eliminated through secretion of the sweat glands. Similarly, we have another gland on the skin called sebaceous glands, or which is also commonly known as the oil glands. Have you ever observed that the hair or the base of your hair, it is quite oily? That is because of the secretion from the oil glands. You would have also seen that sometimes your face tends to become oily, the T-shape especially, that tend to become oily. So that is due to the secretion from the sebaceous glands or the oil glands. So you see, this is how the gland looks like. So they are gland with ducts. So they are located deep inside, but their secretions are sent to the surface of the body with the help of these tube-like structures called ducts. So these oil glands also secrete a lot of waste materials like the waxes, sterols and hydrocarbons, and that is how it helps the body to get rid of all these unnecessary substances. So these are some of the other important excretory organs of our body other than the kidneys, which also participate or which also contribute, whether it is less or more, to the process of excretion, or it contributes to remove wastes from our body. Now let us look at some of the very common excretory disorders. What can happen to a person if the excretory system is not functioning properly? Now some of the common disorders of the excretory system are uremia, kidney failures, renal calculi. So these are some of the very common disorders. Glomerulonephritis. So let us look at the causes and symptoms of these disorders. Let's first talk about uremia. Now this is a situation or a condition where the urine has blood in it. So blood is found in the urine. So that condition is known as uremia. So the cause is urea and wastes get accumulated in the body. Now this condition, uremia and kidney failures, they are very closely related to each other, because in both the conditions the kidneys do not perform their job correctly. Now what would happen if the kidneys are not functioning properly? The job of kidney is to purify blood, is to remove the waste materials from the blood. If it is not functioning properly, in that case, a lot of nitrogenous wastes like urea or uric acid, they will start getting accumulated in the blood. And that will cause so many different problems. So this condition, when you actually get to see blood in your urine, that is known as uremia. And what are the symptoms? Nausea, vomiting, weight loss, shortness of breath, irregular heartbeat. So these are some of the common symptoms of uremia. The next one is kidney failures. It is a very deadly condition when your kidney do not function at all. We call it kidney failure or renal failures also. And it is that acute condition when the kidney completely stops functioning. So in this case, the kidney doesn't function at all, so waste accumulation has to happen. And in this case, if nothing is done immediately, then the person can even die. So some of the solutions which have been found are, one is the permanent solution to this is the only one, that is kidney transplant. So the kidney needs to be transplanted from somebody else's body, a good kidney from somebody else's body needs to be transplanted into the patient's body. Now it is not required that both the kidneys need to be transplanted. Even if one kidney is functioning, at least that one kidney can take up the job of purifying the blood and the patient can survive. But again, kidney transplant is not very easy, because you actually need to see the compatibility of the kidney of one person inside the body of the other person. So there has to be a lot of tests and a lot of investigation needs to be done to check on that compatibility part. So that is one permanent solution to it. Another thing which is often done is known as dialysis. Maybe you would have heard of this term dialysis. So what happens there is, with the external machinery, the blood is taken out of the patient's body, and then the blood is externally purified, and then the dialysis fluid, which contains all the components of blood except the nitrogenous wastes, and that dialysis fluid is then entered into the patient's body. So basically that dialysis machine performs the job of a kidney. Now dialysis cannot be done every day, because if your kidney is there inside your body, it is functioning 24/7. So it is actually purifying or removing wastes from your body all the time. But dialysis cannot be done always, so it is often done in periodic intervals of time, maybe once in a month or once in 2 months or once in 15 days, depending upon the condition of the patient. So that is another temporary solution. However, in acute conditions, dialysis might not help. So some of the symptoms of kidney failures are, again, it is going to be similar to that of uremia, like shortness of breath, chest pain, headache, weakness, etc. So actually there are a variety of symptoms that are seen in patients. So it depends, or it varies from one patient to another. Acute kidney failures can be corrected only by kidney transplant. The next is renal calculi. It is a very common disorder which happens in many of us. Renal calculi means stones. So formation of stones inside the kidney. So inside your kidney some stones are formed. Now what are these stones actually? So are they the stones which we see outside in the ground or something? Are they made up of sand or something? So what are these stones? Now there can be a variety. These stones are nothing but solid mass of crystals. So these crystals, these solid masses can be made up of calcium, they can be made up of oxalate. So there are a variety of stones which might be formed. They can be made of calcium, they can be made of uric acid, they can be made of oxalate. So it depends which type of stone is developed inside one's kidney. Now generally these kidney stones are formed if somebody consumes less water, because if you consume a lot of water, in that case, since water tends to pull out things and dissolve in itself and then throw it out through the excretory system. So if somebody tends to consume less water, or if somebody tends to consume some food materials which are rich in any of these, for example, let us suppose somebody has developed calcium stones in their kidney, and if they take in a lot of calcium, in that case that the condition might aggravate. However, this is not a very severe condition because this can be treated with medication, and sometimes if it is too severe, it can be treated with surgery. It is just that the stones need to be removed from the kidney. Now, there are medications by which these stones might get dissolved or might come out through the urine. It can be a very painful condition if the stone gets stuck in the ureter or in the urinary bladder. These stones are formed in the kidneys, but they are not painful when they are inside the kidney. They tend to be painful only when they come out into this tube. Some of the symptoms are vomiting, pain in the side of abdomen. Sometimes some people get lower back pain, chills, fever. These are some of the symptoms of kidney stones or renal calculi. Thank you. Please visit www.examfear.com to watch more videos, attempt free online test, get free study material, find tutors and mentors. Thank you once again.